Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, today, as always, we are on 88.1 WBFH The Biff and Birmingham Area Municipal Access. The Megacast Monday through Friday, live from 10 a.m. to 12 noon. Our TV stations, both Birmingham Area Municipal Access and Civic Center TV, are on Comcast Channel 15 and AT&T Channel 99. You can also watch online in high definition on civiccentertv.com. And today, on our Facebook Partners page, Oakland University on this OU Friday edition of the Oakland County Megacast. We thank Oakland University and all of our Facebook partners throughout the weeks here that join us on the program on a variety of different media outlets. It's not just a TV broadcast, radio broadcast, or a simulcast. It's a combination of all of the above from community outlets here in the local Oakland County area, bringing you the latest news and information about COVID-19 and other top news and information on our website at civiccentertv.com/coronavirus. We have links to reputable resources such as the Centers for Disease Control, the state of Michigan, Oakland County, and your local hometown, as well as today's top stories and our top stories each and every day. Today, our top story, the MIAA has postponed fall sports. Football and all fall sports have been postponed by the Michigan Intercollegiate Athletic Association, though some member schools hope to compete in the fall as independents. Adrian College, Calvin College, Trine University are all exploring options to compete in all fall sports that are normally sponsored, while Olivet College will explore options for competing in cross-country, golf, and tennis this fall. The MIAA will develop schedules for football, cross-country, men's and women's golf, men's and women's soccer, and volleyball to take place later in the academic year. Quote, "We recognize the deep disappointment this decision has for our student athletes, coaches, and parents at schools that will not be competing," and closed quote, said MIAA Commissioner Penny Allen Cook in a statement. Continuing that statement, she said, "While this decision is very disappointing, our first priority is fostering safe and productive learning environments on our campus." So the MIAA, the latest of colleges and definitely in the state of Michigan sports leagues that have decided to postpone or forego their season in any particular sport due to COVID-19's continuing pandemic. We've seen certain schools decide that they're going to shut down operations of certain sports teams. Many athletes on the professional level and even on the collegiate level this week, Division I, Division II, Division III, have announced that they are going to forego this upcoming season, and schedules have been changed all around as leagues have decided we're only going to play within our league. We're only going to play a certain number of games. This is going to continue to be a trend, I think, as we approach the fall and the coronavirus pandemic continues to vary and continues to change over time.
I'm surprised we're even still talking about this. It seems they would have ironed out this plan earlier. This is not surprising. One thing I wonder, why not cancel the season and then maybe still have your team where you play one another? And so you're keeping it confined to your bubble, and the kids still get to play sports, but you're not exposing them to other schools and kids that you don't know where they've been, things of that nature. And if we're doing remote learning, how are you going to have sports?
It's an interesting question. And then on top of that, you mentioned playing in close proximity, maybe with schools that are in your same state or same general area. I would go even further to say maybe you limit it even to just club sports and make sure that those specific club sports athletes are taking their precautions. Maybe allow some of the higher level athletes, if they want to continue to play ball and potentially have the opportunity to showcase more of their skills through social media and so on, to be able to play club sports instead of on the regular teams. As they're playing just within the campus there. I'm sure there's going to be even more variables to come for our sports seasons in all of our leagues, both amateur and professional, as we approach the fall and this coronavirus pandemic continues to further complicate itself. More top stories, civiccentertv.com/coronavirus. The University of Michigan will lead a plasma research. Some Michigan patients mildly sick with COVID-19 may soon help determine whether plasma from recovered patients can curb the infection before it becomes life-threatening. Quote, if you can neutralize the virus in your system early before the damage to organs, that will give you the best chance of early recovery, said Dr. Frederick Corley, an emergency room doctor at the University of Michigan Medicine and one of the trial's investigators. U of M will lead the collaborative and the research on the $7 million effort called the Clinical Trial of COVID-19 Covalescent Plasma of Outpatients, or C3PO trial, alongside teams from the University of Pittsburgh, Medical University of South Carolina, and Stanford Medicine. Covalescent plasma is donated by people who have recovered from a COVID-19 infection with hopes that they have built an immune system response to the virus that can be shared with others. Antibodies captured in plasma are usually collected by donation agencies such as the American Red Cross and other accredited blood banks. So we talked earlier this week, the Red Cross was looking for donations for more people with convalescent plasma, people that have had COVID-19 and have recovered, to donate plasma due to a shortage nationally as they continue to help fight the frontline battle against COVID-19. U of M now going to engage in a research project to determine if convalescent plasma can prevent severe damage to people's organs, or prevent that preemptively before the virus gets too serious.
They've already shown that this does work. However, it's been limited to very severe cases of COVID-19. So this research, they're hoping to find people in the very beginning stages of the virus and to see if it does help stop it. And it could be another treatment, and we are seeing that come out. We had Henry Ford Health Systems, they're doing the vaccine trial. Now we have this. So the medical community is really coming together in a collaborative effort to try to find treatment and a vaccine against this virus.
A lot of work being done in the medical community in order to make sure that there are multiple ways to battle this virus and ultimately a cure to the virus so we can end this pandemic as safely as possible and as swiftly as possible as well. And as we continue to fight for a vaccination for COVID-19, Michigan seeing fewer vaccinations in general in the state of Michigan due to the pandemic. Fewer Michigan children have got vaccinations while the state was in the throes of the coronavirus-related shutdowns, leaving health officials worried about the spread of preventable diseases like measles, whooping cough, and influenza. Vaccines have increased since they took a deep drop this spring, but numbers are still down significantly compared to 2018 and 2019, according to the state health department. In June 2020, dosages of vaccines administered through federal or state funding dropped by 10% compared to an average combining June 2018 and June 2019, according to the Michigan Department of Health and Human Services. Children enrolling in Michigan schools and child care centers need to either get vaccinated or obtain a waiver, citing their medical, philosophical, or religious reasons for not doing so. This goes right into the category that we've been speaking at length with medical officials in the community over the last couple of days, Ronnie, of people being apprehensive to go back to the doctor. And that was definitely the case in the thick of the pandemic. Early on, there were shutdowns, so they couldn't go. So some could not go, or others were not going to be going because these primary care physicians were focused more immediately on COVID-19 related issues. Then, as the offices reopened more to the public, people were apprehensive to go out because of the spread of COVID-19, and many may have missed vaccination appointments for their kids in certain time windows, and now are either playing catch up or are approaching the school year and their kids are not yet vaccinated and ready to go.
And I think some parents are also waiting to see if they're going to have to do remote learning, and therefore they wouldn't need the vaccinations. But some communities are trying to help with this, and they're doing drive up vaccinations to try to encourage parents to get their kids vaccinated before they go back to school, because it's also getting harder for them to get appointments with their doctors because of so many kids needing this.
More stories like that and others at civiccentertv.com/coronavirus. In addition to our top news stories each and every day on civiccentertv.com/coronavirus, we also have links to resources from the Centers for Disease Control and Prevention, the state of Michigan, Oakland County, and your local municipality, your hometown. All of those links go straight to the pages on those websites related to COVID-19 prevention and information. So you know when you go to civiccentertv.com/coronavirus and you click on our coronavirus page and you click on any of those links, you're going directly to the source of information. You don't not have to worry about getting misinformation from a variety of other sources that you may not be able to trust. These are straight from sources in our community, in the state of Michigan, and on the federal level, providing you coronavirus information that's up to date, including, if you look here, we'll go just quickly to the Oakland County website. They have information that allows you to contact Oakland County with any questions you may have about COVID-19. If you're a local business, want to request a COVID-19 toolkit, you can do that on Oakland County's website. And in addition to that, you can find and set appointments for testing for COVID-19. They have the Nurse on Call hotline, as well as ability to contact the Nurse on Call or the hotline through email on oakgov.com on their coronavirus page, which you can access from civiccentertv.com/coronavirus. In addition, we have plenty of information coming to you each and every day on our program on the Oakland County Megacast, live from 10 a.m. until 12 noon. And if you miss any interviews, if you miss any episodes and you want to go back and watch certain sections of interviews that maybe you missed, you come in halfway through and you want to see the whole thing, civiccentertv.com/megacast. I'll go over there real quickly for you to show you what that's all about. You can learn more information about our partnering stations, about the show itself, and find links to our full episodes if you tune in halfway through, partway through, or have to leave short way through the show. Short clips if you don't have a lot of time, but you want the most important information from each day's program, and full interviews as well. That's online, civiccentertv.com/coronavirus and civiccentertv.com/megacast, your home for coronavirus COVID-19 pandemic information in Oakland County in our coverage area. And we thank you for being with us each day, 10 a.m. to 12 noon, as we talk to a variety of interesting guests all throughout the community about a variety of COVID-19 related topics. And joining us today, our first guest from Oakland University. He is the Senior Vice President for Student Affairs and the Chief Diversity Officer at Oakland University. We're pleased to be joined now by Glenn McIntosh on the Oakland County Megacast. Glenn, thank you for being with us today.
Thank you for having me today.
We appreciate having you. How are you? How's your team over at Oakland doing?
Well, we're doing well under the circumstances. We're getting ready for the fall semester with a lot of variables, and so we're planning a lot of scenarios based on the different stages that we're in right now, from stage 1 to stage 6, which is the end of the pandemic.
So Glenn, as we're approaching move-in day, we're getting really close to the beginning of the school year. We're getting really close to students moving in, some for the first time at Oakland University. What kind of impact has the COVID-19 pandemic had on planning for student housing at Oakland?
Well, it's had a great impact on our planning for the fall semester. First and foremost, at our university here at Oakland, the health and safety of our campus community is priority. And so when we talk about the residence halls, it's a living and learning environment. Our capacity is 13, well, in some buildings it's 1,300, but our total capacity is 3,500. Right now we're seeing about 2,500 new and returning students. And so that number will probably go up because we're just at the tip of our orientation season with a couple more orientation sessions to go. And so we're doing a lot of planning around creating that safe environment in our residence halls. We've actually reduced our occupancy for the halls, and so we've given students the luxury of indicating whether they want a single room or if they want roommates. Surprisingly, most of our returning students have indicated that they have, friends that they want a room with. Some of the things that we're doing is requiring all of our resident students to be tested for the virus prior to moving in to the residence halls and the apartments. And we're planning a testing period in mid-August for those students to get the results back, and then they can move in if they test negative. We're also doing a lot of education awareness campaigns for our students letting them know our requirements as far as sanitization of the rooms as well as the residence halls themselves. Our custodial staff is doing a lot around cleaning. We've bought different apparatuses such as foggers that will cleanse surfaces very quickly. And so we're doing a lot.
One of the things we were talking about yesterday, how are you going to handle the dining halls for the students?
Mm-hmm. Well, that's a good question. We have a food service provider that we've been meeting with over the last 3 months, Chartwells. And one of the things that we're doing is really limiting the number of students in the cafeteria at one time. We're doing social distancing as it relates to the cafeteria style where you select your own foods and serve yourself. That won't happen in the fall semester. And so most things will be prepackaged. We'll also have an option for students to have delivery to their room in cases where they need to be isolated or quarantined. And so we're taking all kind of precautions to make sure that our food service workers are trained properly to service our campus community, particularly our residence hall students.
Glenn McIntosh with us. He is the Senior Vice President for Student Affairs and the Chief Diversity Officer at Oakland University. So Glenn, on that note, you mentioned food services in case students need to be quarantined. Earlier on this week, summer students at Michigan State University had a couple of positive tests inside Holmes Hall, and they are now going through a process of quarantining and checking on those students. In the event that there is an outbreak, whether it be in one specific room with a couple of roommates or a couple of rooms in a specific dorm hall, how is Oakland University going to handle a situation or situations this fall where a student or students in one of your residence halls or multiple residence halls do become infected with COVID-19?
Well, if they test positive and they're residence hall students, number one, upon moving in, we're asking students to identify a place that they would convalesce in. And so the question would be, do they have the capacity to return home? Now, in some cases, we understand that won't be possible because the distance home will have international students, outstate students, where returning home won't be an option. And so what we've done is actually created space within our residence halls. And actually, we've taken one of our residence halls offline for isolation and quarantining purposes. And so in the case where the student cannot move home, we would actually isolate them or quarantine them in that residence hall that we have on standby. In that residence hall, we'll make provisions for the students to actually be able to continue classes as well as receive 3 meals a day.
Glenn McIntosh with us. He's the Senior Vice President for Student Affairs and the Chief Diversity Officer at Oakland University. So as we're preparing for the school year and as students are getting ready for moving in just a few weeks, what are some of your top pieces of advice for students and their families, especially incoming students in their first year at Oakland University, maybe even their first year of college, to prepare for coming to campus this fall under these specific and very unique circumstances?
Well, I would tell them to prepare to abide by some of the federal and state guidelines as far as, personal hygiene, social distancing, certainly face covering, all those things. And that college experience that they may have looked forward to, we're going to try to provide that as much as possible. The student organizations, we have 350 student organizations, and those student leaders will be trained on how to provide their services in a hybrid situation, some face-to-face, but a lot remote. And so I would convey to parents and students that we have to embrace the whole concept of newness. And so the college experience will alter slightly, but it's for the health and safety of the student as well as others in the campus community. And so I would say it's going to be a great experience in the fall, but it's just going to be different. And so when they move on to campus, understand the expectations that we have of them. Again, abide by them, cooperate with us, because our total intent is to make sure the fall semester goes off without a hitch and that we have this hybrid environment where there is some face-to-face classes as well as remote.
Do the students have the option to go full remote if they wish to, even if it's halfway through the semester?
They do have that option. And so they need to register for classes that are in their remote environment. But if something happens, let's say their health is jeopardized in any way, or they become positive with the virus, we can shift them to an online schedule. So our academic affairs division, led by Dr. Michelle Piskulich, has done a lot of planning with our faculty for these types of situations.
Are the students going to have access to the workout facilities?
Yeah, that's a good question. As of right now, by executive orders of the governor, places like rec centers and arenas are closed down. If that changes, certainly we'll open up the rec center again, utilizing what we know about social distancing, and probably alter our hours of operation. Our intramural sports will alter those. But still, once she takes off the closed order, we will be open for students to use that center.
Glenn McIntosh with us. He is the Senior Vice President for Student Affairs and the Chief Diversity Officer at Oakland University. So you have a unique facility at Oakland University, a unique operation. It's the first year advising center that was established over at the university. It helps transition high school students to college, and that's a difficult transition, and the added stresses of COVID-19 certainly add to those stresses as well. How important will that team be in helping your new students maneuver this transition in their life as they begin their educational journey at Oakland University?
Well, the staff in the first year advising center will be invaluable. You know, when you think about it, these students who are coming in as freshmen, they had a rough offboarding from high school. Some didn't experience final exams. They didn't have proms. You know, they didn't have commencement ceremonies. And now we're saying you're going to enter into the college environment, and maybe 50% of it will be remote. And so those academic advisors will spend a lot of time with students in the orientation process and beyond. We have a course called Com 101, and it's kind of like an orientation to the university and the services. And so the staff in the first year advising center, which is led by Sarah Webb, they are really geared up now to be really hands-on with students, very intrusive, communicating with students through all type of technological avenues. And so we're going to really make the students feel like they're at home and that they can really access us 24/7.
On that note also, it's still very different for students that are going to be coming back and experiencing another year at Oakland University or continuing their education at Oakland University. So similar to those incoming freshmen that are transitioning from high school to college, what extra provisions are going to be in place to help those that are transitioning to this new normal, so to speak, that were in at Oakland University as a student coming into this particular fall semester?
Mm-hmm. Well, we'll have a number of things to help in the health and safety arena. One of the things that I'm excited about that we put together is a daily health screening. And that will be an online tool where students, upon entering campus every day, they will have to use their phone or some other laptop device and go in and answer 3 questions about their health. If they have a temperature, if they've been exposed to anyone with the virus. And based on their response to those questions, it will trigger a response to our health center, as well as the student. And if they indicate they have no signs of the COVID, they can come on campus. If not, we're going to ask them to not go to class and stay away from campus. Again, it's just a safety measure. But our returning students, again, we're asking them to plug in and really be leaders. And we really require our students in the 2nd, 3rd, and 4th year to get involved with student organizations. And so they really are role models for our entering students. And so I'm working heavily with our Student Congress, our Residence Hall Association, Student Program Board, as well as our other staff. And so we're going to really pull our upperclassmen in now and ask them to be role models of the kind of behavior that we expect for the fall semester. And so far, they really embraced that idea of actually being an advocate for how we prevent a spread of the virus on our campus.
So Glenn, we are talking about college kids here. They gather in groups. A lot of them do live off campus and the apartments nearby. How concerned are you and the other leaders at Oakland University that this could just spread like wildfire. We've seen the pictures already from across the country. Come on, they're college kids.
Well, don't say that, because I played football in college, and so I wasn't necessarily the most disciplined person when it came to off the field life. But like you said, they're college students. They're in college, they're exploring, they may do some things off campus, as you mentioned. I know Michigan State had an incident at a nightclub that the virus spread through a group of students. But we're going to educate. We have education campaigns that we'll put into effect. Again, use those student organization leaders to really campaign around being safe. And that's what we're hoping for, that they'll be patient. It's just like in a larger society. The idea now is just to be patient. If we can all put on our masks, really invest ourselves in personal hygiene procedures and protocols, we can get through this pandemic, and I think we can get through, in maybe, 6 to 8 weeks if we all just, conform to what are the best practices.
Glenn McIntosh with us on the Oakland County Megacast. He is the Senior Vice President for Student Affairs and the Chief Diversity Officer at Oakland University. As we are approaching this unique fall semester coming up. Glenn, just a couple more minutes with you. Anything else that's important for us to know, or that you'd like your students and families of Oakland University to know as we approach this interesting and treacherous fall semester dealing with COVID?
Well, I would really challenge parents and students and the external community to really look at our COVID-19 website. We have a plan called Grizzlies Protect Grizzlies, and Healthy Together is the theme. And within that plan is laid out that we have 5 steps that we're employing with the idea of creating a healthy and safe environment for our campus community. And so as you move through it, it talks about different protocols that we'll follow, expectations that we'll have, such as the face coverings, the social distancing. All these kind of things will help us, win this challenge that we're up against for the fall semester. And so I'm pretty confident that we're ready. We're scared as heck that there could be some kind of outbreak around us that could find its way on campus, but we're going to do everything possible to control our environment and use all the tools at our disposal to help our students, faculty, and staff to get through this time in our life and our history of the United States. We've never seen anything like this. I'm 57 years old, and I've never experienced anything so challenging that hits all of us on a daily basis.
Well, Glenn, thank you very much for being with us today.
All right. Thank you for having me.
Appreciate
Go Grizzlies.
Yeah, go Grizzlies. We appreciate it. Glenn McIntosh with us, the Senior Vice President for Student Affairs and the Chief Diversity Officer at Oakland University. So many different challenges for these colleges and universities in our state and all throughout the union as they approach the fall semester. And I like the approach that Oakland is taking in this scenario, where they know they can't prevent necessarily every single kind of an outbreak or a major outbreak even, but they're going to do everything that they can to put programs in place to prevent those worst case scenarios and make for an experience for their students, especially those incoming students, that is as smooth of a transition as possible to relieve any stress that they can that's already to a maximum in the situation already.
So much effort and resources are being put into place to try to come up with a safe plan. But at the end of the day, it's in the hands of the students, and their actions are going to determine the outcome. And we are talking about students, 18, 19, 20-year-olds, some of them leaving home, living out on their own for the very first time. Some have never even done dishes, and we want them to maintain these safety protocols. Wishing the Grizzlies the best of luck, but I think we're going to start to see some outbreaks on these college campuses come fall time.
I think we will as well, and I think it's going to be indicative within the first couple weeks of the school year, at least at these major universities in the state of Michigan especially. I know that welcome weeks at places like the University of Michigan, I know for a fact at Michigan State, and at other colleges and universities in the state of Michigan are usually a little less academic and a little more social, and in these kinds of times that we're in, that could potentially be a dangerous situation. So, of course, for you returning students or you going into your first year, we urge you to be responsible. Maybe wait 6 months or a year before you really dive in head first to those kinds of experiences, as we are continuing to battle through a pandemic, and you want to make sure that you put your best foot forward and that you're not putting yourself or your community at risk. While we talk about college education as it prepares for the fall, we'll go back to K through 12 education after a quick break. We'll get a couple of announcements for the good of the public, and we'll come back and we'll talk to Dr. Tina Kerr, the Executive Director of the Michigan Association of Superintendents and Administrators. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations. Ronnie and I will return after this quick break.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM, our flagship TV and radio stations here on the Megacast network of community television and radio stations all throughout the local area. We're also on Birmingham Area Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and the Village of Franklin, that TV channel. Also on Comcast Channel 15 and AT&T Channel 99. You can watch us online in high definition on civiccentertv.com by clicking on our Watch Live link, and listen to us also in the Bloomfield Hills area on 88.1 WBFH. The BIF, that a service of the Bloomfield Hills School District with operations out of Bloomfield Hills High School under the leadership of station manager Ron Whittables. In addition, today we are on the Facebook page of Oakland University via Facebook Live, and thank them for joining us today as our Facebook partner on this OU Friday on the Oakland County Megacast. So we're approaching the school year in the fall. We've talked already at length with Glenn McIntosh from Oakland University about how the Grizzlies and their community are preparing for the fall semester, but our K through 12 schools are still in the thick of deciding whether to be entirely virtual, whether to have a hybrid situation. Teachers on the front lines are showing their frustrations. There's still a lot of complications and a lot of variables in place as we prepare to send our kids back to school in the fall. And joining us now to talk through this complicated time that we're in education, we're pleased to be joined by Dr. Tina Kerr. She is the Executive Director of the Michigan Association of Superintendents and Administrators, with us on the Oakland County Megacast. Dr. Kerr, thank you for being with us again today.
Well, thank you for having me. I appreciate it.
We appreciate having you on. So the last time we had you on, it was quite literally your very first day, just your first few hours on the job at the Michigan Association of Superintendents and Administrators. You've had a few weeks on the job now still. I mean, what a time to come in and begin that job. It's definitely been a busy few weeks. How are you holding up? How are things going at MASA?
Well, they're going well. I think I have a few more gray hairs than when I started a couple weeks ago, but I am proud of the work that's happening across the state to get our school districts ready to restart with face-to-face or potentially online. But everyone's working really hard, and we're doing the best we can to ensure the safety of our children.
Yeah, the safety of the kids has to be paramount as we're returning to school in the fall. It's been really good to see a lot of school districts, ones that we've talked to and others that we've read about as time's gone on, that are providing options to families as well. They're going and saying, well, we're going to have a hybrid situation. We'll have some days the kids will be in school, and one day a week or a couple days a week they'll be online. Others have been completely online, but then many school districts have also provided the option to parents and families to say, if you are more comfortable having your kid in school because you can't provide childcare and you're not going to be home, you have to go to work, or you're more comfortable having your kid learn entirely online because you want to take extra precautions, maybe you live in a home with someone that's immunosuppressed or in a high-risk group, that they're providing those options from your administration, from your organization's point of view. How are you encouraging that kind of flexibility with these school districts as they're preparing for a really complicated fall semester?
Well, absolutely. And that's what we've been working with our superintendents and district leaders across the state. Obviously, too, one of the things they have to keep in mind is this is a very regionalized based issue. So our friends up in the UP, for the most part, have been talking predominantly face-to-face instruction simply because of what the science is telling them. As we move to different areas of the state, the science changes and the districts have to make those adjustments. But the most important thing, again, is bringing kids back safely. However, we do know we have to, I guess, increase our game this fall to ensure that we do not have any instructional loss moving forward. And that's a big challenge in this environment for sure.
With so many teachers concerned about going back into the classroom, how worried should districts be about losing educators, and will you even have enough teachers?
That's the $10 million question right now. And I do think for the most part, our districts have always had very collaborative relationships with their unions and certainly with our teachers across the state. There are concerns on their part to re-enter into those environments, specifically based on if they have any issues that they need to be aware of. However, with the level of safety precautions that districts are discussing, we truly believe that we will be able to return to our environments safely, thanks to all the hard work that's gone in creating these preparation plans for reentry.
Obviously, the focus is going to be on providing the best possible education to the kids of these school districts. That has to be paramount. You have to always be erring on the side of the child when you're thinking about providing education in any situation, and especially in a time of crisis like we're in. But from the teacher's perspective, understanding their concerns as well, and going back to the point about flexibility being provided for these families, are there any discussions within your organization or between administrators and superintendents in the state about the potential for a middle ground with these frustrated or these concerned teachers, and maybe providing flexibility there for some to teach entirely remotely if they are uncomfortable returning themselves to the schools in the fall due to family reasons, health reasons, whatever the case may be?
Oh, absolutely. Districts are already doing that. As they've been working on their preparation plans, each district is a case by case. They have to review it individually. What are their needs? What does their certified staff look like? And, we can expand that too to transportation, food service. There are a lot of areas that we have to pay attention to. If we aren't able to bring our staff back safely and feel confident about that, districts, no, we will not bring kids back. So they're really doing a lot of legwork right now to ensure that they have the appropriate safety procedures in place. They're working with their local health departments to ensure that they can reopen again safely for both staff and students moving forward. So the models look very different. We just completed a survey at MASA and just released those results on Monday. And it was all over the board. We had several that had already made the commitment to online learning to start the school year, which is predominantly happening, I know, in Ingham County and around different areas of the state. And then we had others that are strictly looking at the hybrid model or the face-to-face. Hybrid seems to be a little less, fewer districts are using that model. Most of them are either going completely online or they're planning to re-enter face-to-face. But you mentioned earlier, if a parent has a concern, whether it be for health reasons of their child or a family member, then districts are accommodating to ensure that they still receive a high quality education if it has to be virtual in those cases.
We are in not only a health crisis, but also a budget crisis. How are some of these districts even dealing with these issues when they don't even know what their budget's going to be?
Well, we were very fortunate that the 1920 budget did not have the significant hits that we thought it would. We are still very much working to push for federal support because we're not going to be able to cut our way out of this budget crisis. And districts know that. Now, obviously, districts are feeling some pain from the standpoint they're purchasing PPE, but we do have the CARES money that they can start drawing down on. Those applications have been coming out, so districts more and more are starting to make sure that they can get that assistance to help ensure that they have the appropriate PPE for a restart. So the budget is looming and scary, but we're doing everything we can at the association levels to ensure that we get some support for districts.
Dr. Tina Kerr with us. She is the executive director of the Michigan Association of Superintendents and Administrators with us on the Oakland County Megacast. Dr. Kerr, on that note, with the budgetary issues being what they are and school districts already preparing to shoulder the burden of potential cuts in the 20 and 21 school year, we're still facing an issue financially, and it's a financial issue, it's a social issue, and it's an educational issue of providing the necessary technologies and means to access those technologies for our students if they're going to be learning entirely virtual in the fall, if they're going to be learning in a hybrid situation in the fall, whatever the case may be. At this current point in time that we're in, given that the 1920 budget cuts were not as severe as initially anticipated, but still with the caution of the 2020-2021 budget potentially facing significant cuts, are school districts at a point where they're able to provide the resources necessary to students who maybe are not in a situation where they have access to the internet or access to devices to be able to properly learn in the fall regardless of what the situation is with COVID-19?
I feel districts are doing an exceptional job of trying to ensure that we close this equity gap that we knew always existed, but obviously was amplified during a pandemic. The one thing that I will mention is some of those things are out of their control, which has to do with access. The good news is, Michigan has always had people step up, and we have amazing partners across the state. I'll mention right now, Detroit Public TV has been working since March to coordinate with other PBS stations of this idea of a fifth channel. We may not be able to get the internet access, but if we can run scheduled lessons with a certified teacher via PBS, then that will help us close the equity gap. It's partners like that that continue to step up and try and come up with solutions to ensure that once this is over, that our students don't suffer because of it. So we're going to continue to rely on those partnerships and support that work moving forward as a state.
Dr. Tina Kerr with us. She is the executive director of the Michigan Association of Superintendents and Administrators with us on the Oakland County Megacast as we are approaching a very complicated school year upcoming, and a lot of variables that are at play as we prepare to bring our students back to schools in the fall. Dr. Kerr, earlier this summer, just a couple weeks ago, the Detroit Public School District was required to test all 600 plus nearly 700 students in their summer school programs before they were allowed to continue with those summer school programs. That was a court-ordered rule. Are there any concerns with the school districts, with your superintendents and administrators, that testing requirements may be in place for kids this coming fall, or are they encouraging testing requirements to be in place for this upcoming fall, and how those may present challenges to these school districts?
Well, sure. I mean, those conversations have been happening. Districts, we've looked to our legal counsel as they do and ensure that we're acting appropriately when it comes to student testing or staff testing. But I do feel that our districts have been very flexible and very agile during this process because it changes daily. They may come into the start of school saying, we're going to use this procedure to ensure safety, and then they have to kind of reboot and readjust based on what's going on at that particular time. Certainly, this is all part of their planning process to have these discussions with their health departments. We are looking for support statewide. We've got our various groups that are trying to give more important guidelines of how to handle situations that may arise, and certainly how to handle student testing if that's where we end up having to be.
Is there a concern that this pandemic may lead to more and more kids leaving the public school system?
Of course. That's a big concern. I have worked, again, very hard with external groups. Public education has always been there and always done the good work to support students moving forward. I guess my plea now to families across the state is have confidence in your districts. They are doing everything they can to ensure your students' safety, but more importantly, they're working tremendously hard to ensure a high-quality education. We have some of the best teachers and leaders across the state, and they're ready to continue to do their good work, but we just need that opportunity for parents to have that confidence and to be patient with districts as they try and navigate these unprecedented times. That's our reality.
Dr. Kerr, just a couple more minutes with you before we'll have to let you go. As we continue to inch closer and closer to the fall semester beginning in our schools across the state of Michigan, what are the 3 key points that your organization is really pushing to our local and statewide superintendents and administrators as they continue to prepare and continue to ready themselves for whatever variables may be at play as we enter this school year?
Only 3. Well, for sure, obviously, funding. We know we have to have federal support to support our districts moving forward to continue their good work. The other thing that our organization has really been working on and focusing on is providing guidance. Districts have a lot of questions. We continuously run webinars and bring in elected officials and a variety of experts to give them the appropriate guidance they need so that they can be successful in these reopening plans or in these preparation plans. And then the third, I think, is just being advocates for public education. We continue to try and ensure that our families understand that while this is a challenge, it is an opportunity for us to self-reflect and to continue to be a great organization as far as a district, but more importantly, to continue to provide high quality services to kids. Michigan's success is dependent on the success of the public education system, and we will continue to be advocates and support our leaders moving forward with that as well.
What's the one positive thing you think came out of this or will come out of this?
I think I'd have to mention 2. Number 1, I think it really has shone a very bright light on the inequities that exist across this state. While most may think of that as a negative, I feel that's our opportunity. We knew that inequities existed and there were equity issues, but not to this magnitude do I think that there has been an urgency to address these. So I do believe that is the positive that has come out, is that now we know we have to be vigilant in moving forward of ensuring that we have equitable access for all kids across Michigan and work to ensure that for them. The other opportunity, I think this has really brought all of us together in a very collaborative effort. We're seeing more collaborations that typically didn't happen between business community, education. We've got fantastic work happening across the state as we all pull together to ensure, because this is about the kids and the adults have to do their part to ensure that students continue to have a safe and an exceptional learning experience. And so I think those 2 things would be my top 2, but certainly we need to address our equity problems that exist across the state.
Dr. Kerr, anything else for us today before we let you go?
I'll just give one more plea. Please be patient with our districts as they continue to work very hard for their students and for their families. we need to continue to give them that space that they need to craft these plans and begin to implement them. And I have no doubt they're going to do what's right and what's safe for our students.
Dr. Kerr, thank you very much for being with us today.
Thank you for having me. I appreciate it.
Appreciate having you on. Dr. Tina Kerr, she is the Executive Director of the Michigan Association of Superintendents and Administrators, with us on the Oakland County Megacast. And still so many things that are being worked through by these school districts, by organizations like the MASA, as we're approaching a fall semester where there's still so much unknown. What's going to be the toll of the virus on the state of Michigan at that point in time? What phase of the Michigan Safe Start plan are we going to be in? Are our kids going to be able to have access to technology and access to the internet to be able to engage in all of these programs effectively and efficiently in their homes if they have to learn at home, or if they're learning in a hybrid situation? And how's the situation going to develop with these teachers on the front lines who are, in many cases, growing frustrated with the idea of going back into the campuses in the fall? It's good to know we have organizations like the MASA who are on top of all these issues, are working very closely with school district administrators and with superintendents to alleviate these issues and put the best foot forward for these school districts so that they can best educate our kids during a really tough time in our history.
And one of the things coming out of this is you have to remember it's not one plan for all. Right. Every district is different. Every region is different. So it's trying to come together to figure out what's best for this area and these kids. You know, UP is going to be totally separate than Detroit and West Bloomfield. So it's not, to me, it makes that job so much harder on top of all of this, because you can't just put one plan together. You're having to put dozens of plans together.
And I think that we're also seeing in this situation, one good thing that has come out of this that maybe Tina didn't mention directly, but definitely mentioned in the overall of the points that she made, is we're seeing in real time, and we're seeing with such emphasis just how hard of a job it is to be a teacher in the U.S. at this point in our history, and definitely through crises like this. And I think that if there's another good thing beyond what Tina had mentioned that comes out of this crisis, I would hope it is a greater respect for our teachers, a greater respect for the education system, and a greater emphasis on how important and vital that is to the future of our country.
Oh, Tyler, so many parents, those first few weeks, parents were exhausted. And like you said, they definitely got a new appreciation to understand exactly the work that goes into educating their kids. So coming out of this, a new appreciation for teachers. And also we're seeing teachers are so underpaid on top of all of this as well. So hopefully once we get through this pandemic, we can start to shift the focus to appreciate the teachers more, respect them more, and there, like we said, maybe some positive things are going to come out of this pandemic in the end, and that hopefully will be one of them.
Yeah, at this point in time, the best thing that these administrators and superintendents can do, and these school districts can do as a whole, is put the best foot forward for this fall, for this situation, get through the COVID-19 pandemic as effectively as possible to provide the best possible education for these kids. And then going forward from there, we can work as a society alongside these school districts and thank them for the service they've put in during the COVID-19 pandemic by helping to solve some of these complex problems that have always been there but have been really amplified and put under a microscope by the COVID-19 pandemic. Coming up, we'll take a quick break. And then coming up, we'll talk about senior care with a local expert on the Oakland County Megacast. You're watching and listening to us on our family of TV and radio stations. Ronnie and I will return after this quick break.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Oakland County Clerk Lisa Brown here with some important reminders about voting. Always use a blue or black ink pen when completing your ballot. Fill in the box next to your choice. Don't use an X, check mark, or circle your choice. In the August primary, don't cross party lines. Under Michigan election law, you can only vote for one party's candidates. Otherwise, your ballot will be spoiled and the partisan section won't count. Don't forget to check both sides of your ballot and vote the nonpartisan section. If you want to vote absentee, send a written request to your city or township clerk. Your ballot must be returned to your city or township clerk's office by 8 p.m. election night. And be sure to sign and date the outer envelope. If you spilled coffee on your ballot or made a mistake, you can ask your city or township clerk to cancel that ballot and issue a new one. Please don't use whiteout. If you already returned your absentee ballot and want to change your vote, you need to contact your city or township clerk no later than 4 p.m. the day before the election. Thank you for taking part in our democratic process.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 Lakes FM and Civic Center TV, our flagship stations here on the Megacast network of community television and radio outlets. In addition, today we are pleased to be on the Facebook page of Oakland University on this OU Friday on the Oakland County Megacast. And we thank Brian Barely and the entire team over at Oakland University for making this happen each and every week. And we appreciate having Glenn McIntosh on from Oakland University earlier on in the program. Appreciate having them with us on the Oakland County Megacast today on our final live show of the week. Of course, if you are just tuning in now and you want to listen to full episodes during the week on your way to work or while you're at work, wherever you may be, at home, lounging, staying safe, staying home, we are on 10 a.m. to 12 noon, Monday through Friday, here on the Birmingham Area Municipal Access and Civic Center TV on Comcast, Channel 15, AT&T 99, online in high definition on civiccentertv.com, and on 89.3 Lakes FM, lakesfm.com, and 88.1 WBFH, the BIF, as well as a variety of Facebook partners throughout the week. So, if nothing else, you can't say we don't give you enough outlets to tune in on. We appreciate all of you tuning in, wherever you may be and however you may be tuning in. So, a lot of complicated issues during the COVID-19 pandemic. We've spoken at length about education, but another key issue that we've seen really on the forefront throughout the COVID-19 pandemic has been senior care and providing quality senior care, especially in the times that we're in and the risk factors that are in place for seniors for COVID-19 is so critical. And joining us now is the president of Afnagar Senior Care. It is Shasta Kazmi with us on the Oakland County Megacast. Thank you for being with us today.
Thank you. Thank you so much. Thank you so much for having me.
We appreciate having you on. How are you? How's your team in Afnagar Senior Care?
We're doing great. We're doing great. Today is actually a holiday for the Muslim community. It celebrates actually the end of the Hajj. Yes. So a few of our caregivers have taken off. A few of our staff is off as well. But as usual, I'm working, so no worries there.
Well, happy holiday to you and your team. We appreciate all that you're doing in the community, that your staff is doing in the community, and wish them a much-deserved day off. Wish them well on a much-deserved day off. For those who are not familiar, what does Afnagar provide to seniors in our community?
So Afnagar is actually the first senior care agency which serves the needs of elderly ethnic minorities, actually in the United States. Of course, just being from Michigan, I started a company here. And what we do is we offer culturally similar caregivers to our clients. However, with that being said, we also are bringing with us our cultural values of respecting, acknowledging, and valuing our seniors, and allowing them to age in place with dignity and respect. Our home base here is in West Bloomfield, and we've been providing senior care to various clients and various families since 2014.
Culture is so important to everybody's lives. The way that you are raised, the culture that you take to heart, and the values that you hold are so critical to happiness in general life, especially for seniors. How does your organization incorporate these variety of cultures we have in metropolitan Detroit and in the West Bloomfield area, and tailor the care to the patient specifically based on what may be cultural norms in one culture versus another, and providing this critical care?
So with that being said, caregiving is a common cultural thread for us all. All of us, whatever background you're from, whatever socioeconomic class you're from, caregiving is common within all. The same stresses, the same issues are common within each and every group. However, with elderly ethnic minorities, the issue that we have seen and that we are trying to address is that there is a lot of social isolation, a lot of depression that can occur because they do not feel related to, they do not feel acknowledged by having, caregivers who may not be from the same cultural background as themselves. So, with Michigan being such a huge melting pot, we have caregivers who are from, our Arabic background. There are caregivers who are from Indian background. They can speak Hindi, Urdu, Gujarati, Punjabi, because India has many states, especially even in the Arabic, the Middle Eastern background as well. There's different dialects. Just because they speak Arabic doesn't mean that somebody from Morocco will understand when somebody's from Lebanon. So there was a lot of different kind of tweaks that we had to do with the company of finding culturally similar caregivers to our clients, and then offering culturally competent programs as well. We have felt that caregivers who are from other countries, even if, let's say, they're not from the same state or same province as their client, having an immigrant background has been very helpful to them as well. And that is what we have done. We've tried to help alleviate the social isolation, depression that commonly occurs within elderly ethnic minorities.
This is so amazing that you provide this service, but the healthcare industry in general is having a hard time finding employees. How are you and your team doing on that front?
So that's very true. And one of the things that when I first started the company, to be honest with you, I didn't even know where I could find caregivers who would be of cultural background, similar cultural backgrounds, even as myself, because the whole process to start the company was out of a personal reason. My mother-in-law was living with me. My father became, diagnosed with a horrible neurodegenerative disease. And knowing from, having a medical background, I knew that he would require care down the line. But to even get care in the home at the time before me starting this company was really difficult with my mother-in-law. So when I started the company, what we did is we offered free CNA and home health aid training courses to a lot of the women in our community so that we could train them, so that when I started the company, we would have kind of a huge pool of employees to choose from. But with COVID, a lot of the caregivers were reluctant to come out of the home, because of the exposure that they had with their client. But one of the things that I did was that I, reassured that they would have to get COVID testing, as with our clients as well, and that there would be one client to one caregiver. So that way we would be able to do a contact type of tracing, so that we would know that if the client or the caregiver has been exposed to COVID. But yes, we've had issues in March and April of having the caregivers come out to the home. But with, as, kind of hesitation has gone down a bit, reassurance from the company as well. Oakland County gave a great kit for us to start back, that we're back in business. And that was very helpful to the aides. It gave them a lot of reassurance as well. So that has been very beneficial to us. But it's, again, reassurance. And again, contact tracing that, listen, your aide and your client is just one-on-one care. We're not taking on multiple caregivers to clients in order to reassure the spread of COVID. And we've been very lucky. We've been, even with March, with the COVID cases coming up, we were very lucky where we had 0 issues with COVID transmission. So, we're really blessed for that.
Shasta Cosme with us. She is the president of Afnagar Senior Care with us on the Oakland County Megacast throughout the Oakland County community on a variety of TV and radio stations. And so caregiving has been absolutely critical during the COVID-19 pandemic and from a variety of sources, especially considering the issues that we've seen happen with senior living facilities and with and with nursing home facilities and their relation to COVID-19. You mentioned that you are regularly testing caregivers and testing patients to track potential outbreaks with your clientele and with your staff in a situation where somebody, a caregiver, is going to test positive for COVID-19. What adjustments can your organization make at that point to continue to provide the same care to the patient while also continuing to provide them care from somebody that understands their culture and their backgrounds at the same time?
So there always has to be a plan A, B, C, D, E, F, G with business. You always have to have something like that. So what we did was that if we, God forbid, had a client, a caregiver or a client test positive for COVID, what we would do is we pull them out. Of course, they have a 2-week isolation. We have to get both, unfortunately, the caregiver and the client tested for COVID again. And then we do have enough caregivers that can be placed in the home, and the family is notified and told that, this is the situation. The caregiver may not be from the same background as the client. However, there is somebody who is culturally competent who would be able to provide the care. And with that being said, because of COVID, a lot of families were actually lax on having somebody who could actually speak their language. They were just grateful to have a caregiver come into the home, because many of our clientele we're still working, let's say, in the hospitals or in other, organizations where they were not allowed to have time off or work from home. So they had to make sure that they had somebody who was in their home. There was no choice for that. And so we were very careful on making sure that if, God forbid, there was such an issue, we would have a backup. But the protocols were already placed. And, having a medical background helped a lot, because we were following this. This came to, fruition like in March, but we had been watching this since January. And my husband, having a medical background, just kept telling me, you better be ready, because this thing is going to blow up big time. And it did, unfortunately.
How have you and your organization been in actually being able to get supplies? I know it's a little bit better now, but there is still a shortage on some things like Lysol and things of that nature.
And again, because, of my background and my husband being in the medical field as well, he was like, you better start ordering this stuff now. And this is back in January. So we had supplies of like Lysol disinfectant spray. We also had the wipes. And we were also able to get gloves and PPE for our aides. And what I've done now is that we actually have a friend out in Los Angeles who had a fashion business, which because of COVID, he had to kind of shut things down. So now he's in the mask producing, gown producing, lot of the PPE. So we were able to get our shipments directly from him, goggles, and 95 masks. We have face shields for them. And I've made sure, because with the impending second surge, we just wanted to make sure that we were prepared, because it's far better to be prepared than, be scrambling at the last minute. So we were lucky in that sense. And we had been following it. I mean, we were watching, things not just on the news, but just with, medical journals, stating that this thing is coming, it's on its way, and then we just prepared ourselves. And getting back to your question about the nursing homes and assisted livings, unfortunately, yes. I mean, the COVID unfortunately spread in a lot of those places. We do a lot of staffing for local senior care, local assisted livings. The 2 assisted livings that we do have contracts with, thank God, thankfully, they were also very vigilant, and they had 0 issues with COVID. But it was really touch and go, especially with a lot of facilities in New York and Seattle. It was really scary for families. Even to this day, a lot of families can't go and see their loved one. Unfortunately, that's the situation that they're in. But we were very careful. We, knock on wood, we're really happy about how we handled the situation.
Shasta Cosme with us. She is the president of Afnagar Senior Care, with us on the Oakland County Megacast. Just a couple more minutes with you before we need to let you go. Anything else that's important for our audience to know about what you're providing, about providing quality senior care and caregiving services, or anything else that you would like to touch on today in this interview?
Well, I think one of the last points I want to make is I started this company because, I was in a similar situation. I mean, my father was unfortunately diagnosed with multiple systemic atrophy. My mother-in-law was living with me at the time. I had 3 small kids, and I was doing research actually at Providence and Providence Park in neurosciences. And, I saw the need for culturally competent care. But the other thing that I noticed was that local senior care companies, because of the fact that, they can kind of tap into a kind of some emotional strings of families, knowing that they could charge $20 to $25 an hour to have somebody come into the home to provide their loved one with companionship or companion care, elder or senior care. And I thought they were charging an arm and a leg, and I said to myself at that point, if I ever get to a point in my life where I could start a company, I would start a company that could offer, affordable prices with quality care. Our charges are very, comparatively are very low, because I don't think families should be reprimanded for allowing their loved one to be, to age in place with dignity and respect. I think that, all families should afford care. Unfortunately, there's still not, there's not, something written in, type of our culture, no other type of resources, long-term care insurance. A lot of families have not bought into it. And I think, in the next presidential election, I think it would be great to see one of the candidates come out and talk about how much, what they can do to, help just all seniors in general. I think Joe Biden does have a, kind of a long-term care type of plan for families. And I think it's a really important issue because, as I said, cultural caregiving is, a common cultural thread that we all are facing. And I think it's an issue that really needs to be touched upon. And again, we're here to serve the community. It's just not all elderly ethnic minorities. It's everyone in the community. We have great caregivers who are doing this as a passion of theirs. They're there to, care for the elderly. It's just not a job for them. They're not just clocking in, clocking out on their phones. They're there to help your loved ones. So, that's what we're all about.
Well, Shasta, thank you very much for being with us today.
Thank you so much. Thank you so much for having us.
Appreciate it. Shesa Cosme with us. She's the president of Afnagar Senior Care with us on the Oakland County Megacast on our family of TV and radio stations. We're going to take a quick break. When we return, we'll check in with Erica Jones out in the field. We'll go over our top headlines of the day once again, and then we'll continue on with more interesting guests here on the Oakland County Megacast. We thank you for tuning in on our family of TV and radio stations. Ronnie and I will return after this break.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 WBLD Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake, alongside 88.1 WBFH Bloomfield Hills, 89.3 Lakes FM, of course, is online at lakesfm.com. We're also on Civic Center TV, Comcast Channel 15, and AT&T Channel 99, as well as on Birmingham Area Municipal Access on those same two channels. In addition, today, we're on the Facebook page of Oakland University and thank them for joining us today as our Facebook partner on this OU Friday. We thank Oakland University's entire team, Glenn McIntosh for joining us this morning, Brian Beerley for arranging our great guests consistently from Oakland University, and thank them for joining us here on the Oakland County Megacast as we continue to bring you the top news and information from all around southeastern Michigan, Oakland County, the state of Michigan, and more, including right out in the field in our community where we have Erica Jones today, as always. Erica, where are you at today?
Hey, Tyler. I'm here at the Holocaust Memorial Center on Orchard Lake Road. It is a gorgeous building. You can't miss it as you drive by. For those of our viewers who don't know exactly what it looks like, I will give you a quick look. This is the gorgeous building right here. You can see I'm right out on the road here. Busy day. So exciting news, the Holocaust Memorial Center has reopened for the first time since the whole pandemic hit us very hard. And I have some information about the reopening and how people can visit. So their hours currently are Sunday through Thursday, 10 to 4 p.m. And then Sunday to Thursday, 10 to 4 p.m. Friday, 10 to 2:30 p.m. So Fridays, they close an hour and a half early. And Saturdays, they are closed. And then every day, the first hour that they're open, which is 10 to 11, is reserved specifically for seniors and people who are immune compromised. So they can come without being worried about exposure to younger people or people who might be more likely to spread the virus. So you can sign up for a 30-minute slot to visit the museum. And you can do that online on the Holocaust Memorial Center website, or you can call the phone number, which is listed on the website. You sign up for a 30-minute slot, and they are limiting those 30-minute slots to 10 guests per slot. So you want to make sure you sign up in advance so you're able to get one because it is limited. Anyone over the age of 5 has to wear a mask. And if you forget your mask, they are selling masks for $1 at the museum. They have lots of heightened cleaning protocols. So they're constantly cleaning all the railings and the exhibits, everything that anyone might be touching or be exposed to is being cleaned. The bathrooms are being cleaned more often, and they do have hand sanitizer available all throughout the museum. So they're doing a lot of things to make sure that everyone is safe and throughout the entire museum. Unfortunately, we were not able to go into the museum today, but they have markings all across the floor to make sure people are staying social distance. But again, they are only allowing 10 people at once for the 30-minute appointments. So social distancing should not be too much of a problem for people that are inside.
Erica, thank you very much for that report. Erica Jones out at the Holocaust Memorial Museum in Farmington Hills with us on the Oakland County Megacast. We thank her for joining us as they reopen this week, like many other museums and other organizations that support our knowledge of local history and of world history in the Oakland County area. We appreciate that report from Erica Jones. If you are interested, you can find more information online about the Holocaust Memorial Museum and learn about another treacherous time in history for many other reasons non-related to a spread of a virus. And history is so important. We've talked about it at length over the last couple of weeks, and it's good to know that another great organization in our community that is supporting spreading the information about history and important stories to our community has reopened. Thank you, Erica, for that report. We'll take a quick break, and when we come back, we will go through today's top headlines and speak to our remaining two guests here on the Oakland County Megacast. You're watching and listening to us on a family of TV and radio stations. Ronnie and I will return after this break.
This seems uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green or blue.
But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl. You're watching and listening to us on Birmingham Area Municipal Access and Civic Center TV on Comcast Channel 15 and on the AT&T Channel 99 Public Access Education and Government Community Channels Guide within AT&T Uverse. You can also watch us online on civiccentertv.com/watch-live or go to our homepage, civiccentertv.com. Click on the Watch Live link and you'll be able to watch the Oakland County Megacast live from 10 a.m. to 12 noon, Monday through Friday in crisp, high definition. In addition, you'll be able to watch all of our original programming, including municipal meetings and imported programming such as the League of Women Voters candidate forums, which we will be playing regularly all throughout the weekend and Monday as we are approaching the primary elections here next week, and we have some messages for you. Absentee ballots need to be in West Bloomfield. This is from West Bloomfield Township Clerk Debbie Binder. Different rules may apply in different communities, and you can find information from those communities on our website, civiccentertv.com/coronavirus. Absentee ballots need to be in by Monday at 4 p.m. People need to drop them off at Town Hall, and they're encouraged to drop them off at Town Hall instead of going through mail, because the mail is slow and they likely will not get to the clerk's office or and be submitted by the time that the precincts close on Election Day. Town Hall is also going to be open on Saturday, 8 a.m. to 4 p.m. Many town halls and city halls throughout the local area are open on the Saturday before these elections to accommodate people dropping ballots off, trying to register, and for answering any questions they may have about where their precinct is, how the elections are going to be affected by COVID-19 and more. Most municipalities are open on the Saturday before those elections, and we encourage you, if you have any questions, to contact your local clerk, and we have helpful information on the website that brings you directly to the websites of these various municipalities in a coverage area. If you go to civiccentertv.com/coronavirus. In addition, we have links to reputable resources from the Centers for Disease Control, the State of Michigan, Oakland, and Oakland County's COVID-19 pages, as well as our top headlines each and every day, Monday through Friday, 10 a.m. to 12 noon on our Megacast live shows, including today's top story. The MIAA has postponed fall sports. Football and all fall sports have been postponed by the Michigan Intercollegiate Athletic Association, though some member schools hope to compete in fall as independents. Adrian College, Calvin College, and Trine University are exploring options to compete in all fall sports that they normally sponsor, when Olivet College will explore options for competing in cross-country, golf, and tennis this fall. The MIAA will develop schedules for football, cross-country, men's and women's golf, men's and women's soccer, and volleyball to take place later in the academic year. A quote from the Michigan Intercollegiate Athletic Association Commissioner Penny Allen Cook: "We recognize the deep disappointment that this decision has for our student athletes, coaches, and parents at schools that will not be competing. While this decision is very disappointing, our first priority is fostering safe and productive learning environments on our campuses." Many schools concerned about the spread of coronavirus in the fall, just in general, and with traveling sports teams going to different states in the region within their leagues, and interacting with a variety of different people, those concerns are amplified because the more interaction you have, the more variables you are facing in terms of where have people been, who have they interacted with, are they asymptomatic, and so these concerns are being taken to heart, and in an abundance of caution, the Michigan Intercollegiate Athletic Association has decided to forego all fall sports.
I'm actually surprised that we're not seeing this across the board for high schools and all colleges, because, like you said, there are so many variables here, and especially football. I mean, football is a contact sport. How can you play football and not, interact with one another? So it's going to be interesting to see as we get closer to the school year, if some of these, some of these teams and some of these schools, if they've allowed it, if it will continue on, or if that season will be shortened at all.
Yeah, some of these schools, as was reported in this article that you can find on civiccentertv.com/coronavirus, are going to act as independents this year. If you're familiar with the NCAA, which is a different college sports organization, independent colleges, it's like what you'd see from Notre Dame. They don't play in a conference in football. They're their own independent. They make their own schedule. This year, of course, they're doing the opposite of that and are going to be playing in the ACC and the NCAA instead. But some of these colleges are going to continue those sports regardless of the MIAA's decision. They just will not play within that specific league. We'll continue to stay on top of the story as other colleges and universities and organizations make decisions about fall sports. Other top stories, civiccentertv.com/coronavirus. University of Michigan will lead plasma research. Some Michigan patients mildly sick with COVID-19 may soon help determine whether plasma from recovered patients can curb the infection before it becomes life-threatening. Quote, if you can neutralize the virus in your system early before the damage to organs is done, that will give you the best chance of early recovery, said Dr. Frederick Corley, an emergency room doctor at the University of Michigan's Michigan Medicine Center and one of the trial's investigators. U of M will lead the collaborative and the research on the $7 million effort called the Clinical Trial of COVID-19 Covalescent Plasma of Outpatients, or the C3PO trial, alongside teams from the University of Pittsburgh, Medical University of South Carolina, and Stanford Medicine. Covalescent plasma is donated by people who have recovered from a COVID-19 infection with hopes that they built an immune response to the virus that can be shared with others. Antibodies captured in plasma are usually collected by donation agencies such as the American Red Cross and other accredited blood banks. And we did see earlier on this week the American Red Cross calling for a need for increased donations, particularly of convalescent plasma from people that may have had COVID-19 and recovered, or maybe asymptomatic and not know about it, and maybe have convalescent plasma that could help these patients that are battling COVID-19, prevent them from severe symptoms and complications such as damage to vital organs.
We've seen this actually work for combating the virus. However, it's only being used right now in people with severe symptoms of COVID-19. This is going to allow them to use it on some of the patients that are in the early stages to hopefully keep it from getting worse. And so it's much needed. So I had a cousin and she did test positive and she was able to donate. So one of the things is you do have to have been tested and proven that you did indeed have COVID-19.
Individuals who have fully recovered and have a verified COVID-19 diagnosis are urged to sign up to give convalescent plasma now by completing the donor eligibility form through the American Red Cross, as we are showing you now if you're watching on TV, on Civic Center TV, Birmingham Area Municipal Access, civiccentertv.com, or the Facebook page of Oakland University, redcrossblood.org. If you type in, we have this long link up here, but if you simply type in redcrossblood.org/plasma, the number 4, COVID, redcrossblood.org/plasma, the number 4, COVID, it will bring you directly to this page where you can sign up to give convalescent plasma and potentially help people that are battling this COVID-19 infection, potentially prevent themselves from severe damage to their organs, which is a severe symptom, of course, of COVID-19. Lastly, a top story is at civiccentertv.com/coronavirus. Vaccinations are down in the state of Michigan due to the pandemic. Fewer Michigan children got vaccinations while the state was in the throes of the coronavirus-related shutdowns, leaving health officials worried about the spread of preventable diseases such as measles, whooping cough, and influenza. Vaccines have increased since they took a deep drop this spring, but numbers are still down significantly compared to 2018 and 2019, according to the state health department. In June 2020, dosages of vaccines administered through federal or state funding dropped by 10% compared to an average combining June 2018 and 2019, according to the Michigan Department of Health and Human Services. Children enrolling in Michigan schools and child care centers need to either get vaccinated or obtain a waiver citing their medical, philosophical, or religious reasons for not vaccinating their children. And we're seeing this is one of those side effects of the pandemic for those that do have medical, philosophical, or religious reasons that do not prevent them necessarily from getting these vaccinations, have not gone and gotten their vaccinations. And of course, those that have those objections to vaccines aren't getting them anyway. But we're seeing an increase in children overall, combining those two groups, not being vaccinated as a result of the COVID-19 pandemic and people staying away from the doctor's office throughout this process due to a fear of contracting the virus.
Yeah, so there are several reasons they believe behind this, not only due to the fear of going into a doctor's office, but on top of that, now it's getting harder to get an appointment. and to get that, because there is a backlog of patients trying to get into the doctor's office so that they can get their vaccinations before school. And I think a lot of parents were also waiting to see if their kids would actually be going back into the classroom.
We'll have an expert with us in just a couple of minutes on infectious diseases that can give us a better outlook on how critical vaccinations like this that are being missed are for these kids as they are returning to school and just in the general health sense. While we're dealing with an infectious disease right now, such as COVID-19 and that virus, these other viruses that have vaccinations can also become problematic in schools if children are not vaccinated as well. And we'll get that insight in just a couple of minutes. Ronnie and I are going to take a quick break. When we return, we'll be joined by Dr. Preeti Malani, the Chief Health Officer and a Professor of Medicine in the Division of Infectious Diseases at the University of Michigan after this quick break. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19. To make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl. You are watching us on Civic Center TV and on Birmingham Area Municipal Access on Comcast 15 and AT&T 99. In addition, we're on the radio on 2 great community radio stations, of course, 89.3 Lakes FM and on 88.1 WBFH The Biff. Today we are joined by Oakland University on their Facebook page via Facebook Live, and we thank their entire team for joining us on this OU Friday on the Oakland County Megacast. Now, that may be the case, it may be an OU Friday, but that doesn't mean that we aren't going to go to our other experts from throughout our great universities in the state of Michigan, including, and yes, I'm a Sparty, and I'm going to say for educational purposes, the great University of Michigan. We're joined now by Dr. Preeti Malani, who is the Chief Health Officer and Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. Joining us once again, Dr. Malani, thank you for being with us today.
Thank you for having me.
Appreciate having you on. How have you been since we last spoke?
I've been great. You know, summer in Michigan, what can you say?
Oh, yeah.
It's been busy.
Yes.
But it's been great.
So, Dr. Malani, we are preparing to return our kids to school in the fall. In just a couple of weeks, they'll be going back to some to in-person learning and some to virtual learning, some to a hybrid situation. And we saw an article today that vaccinations for kids has gone down significantly over the course of the COVID-19 pandemic in relation to June of 2018 and 2019, as people were staying away from their doctor's offices or were apprehensive about going in case they could potentially on the way there or somewhere else they stopped pick up the COVID-19 virus. For kids returning to school, how critical is it for kids at a young age to get these vaccinations? While we maybe don't see some of these diseases like measles and whooping cough and necessarily spread rampantly much anymore, these vaccinations are still critical for these kids at a young age.
Yeah, absolutely. And I'm glad that you brought this issue up because the focus is so much on COVID. And of course, we're worried about COVID, but In the meantime, all the regular health issues are also important to keep track of. And in kids, that means getting their routine vaccinations. And this is something that, if you missed your 5-year appointment or your 4-year appointment, you could very easily miss a large number of vaccines that are so important. And then it takes a little bit of effort to get caught up later.
Dr. Malani, as we have continued through this pandemic, we've seen that various needs from the medical end of the spectrum as these people are being treated for COVID-19, as we learn more about how to treat COVID-19. There are different needs that come up in the community, and right now the American Red Cross is urging those who have had COVID-19 and either have recovered or have been diagnosed and were asymptomatic to donate blood specifically for convalescent plasma. For those that are not medically sound, that are not experts in this or don't know how to dissect the research on convalescent plasma and its effect in treating COVID-19, how can convalescent plasma from those that have recovered from COVID-19 potentially help those that have contracted the virus prevent themselves from having severe complications like damage to vital organs?
Yeah, so this is something that is evolving and emerging, and there are research studies that are ongoing, but the idea of convalescent plasma is pretty simple, and it goes back 100 years and more. The plasma component of the blood, so this is like the yellow area of the blood, the part of the blood that has antibodies, is removed, and then it is made sure to be safe, and then given to someone who is ill with COVID-19. And right now, this is being done really in the hospital setting for patients who are critically sick. It's not being done in people that have mild illness, and it's not being done for prevention, although that is one of the many questions that remains. And again, the idea here is that after you have had COVID-19 and recovered, you have produced antibodies that help protect you against reinfection, although that's also something that we don't fully understand. And in this case, by removing the portion of the blood that has those antibodies from someone who has recovered and then giving them to somebody who is ill, is felt to be beneficial. And again, these are smaller studies, and these are studies, some of them are coming from China, where their experience is a few months longer than ours. There's a suggestion that this is helpful. And in the clinical setting, we're reserving this for people who are quite ill. We wouldn't want to do it in somebody who has mild illness, although so far it's looked quite safe.
So, Doctor, I watched Pandemic on Netflix, and it was so eye-opening to me. As someone who studies infectious diseases, how concerned are you that we could see this happen again?
Yeah, so Ronnie, I'm concerned that this could happen again, and we hopefully are going to, as part of the response is building all those systems to help prevent this from happening again. That has to be part of it, not just focused on all the issues that are important at this moment, but rethinking our surveillance, rethinking how we track information, rethinking vaccine development. But absolutely, it could happen again. I certainly hope it doesn't ever happen again. And fortunately, these are things that can be prevented with careful planning and surveillance.
So one thing that has come out of this is the collaboration across countries, across medical communities, and trying to get a vaccine. Do you think we need to continue that work going forward? And have you ever seen anything like that before?
No, I don't think anyone's ever seen anything like this before. And I think this is one of the silver linings of the pandemic. The idea that, and it's not just countries and different kinds of medical professionals, but it's private companies or pharmaceutical companies partnering with the government, in this case, certainly in the United States and around the world, where combined and in a coordinated fashion to pick the 5 or 10 vaccines that look to be most promising, and then really putting a lot of effort around that. And where we learned a few days ago that the University of Michigan is likely going to be a site for one of the vaccines, the one coming from England, from Oxford. And just seeing that planning process, the scale of it, is something that has never been seen. But it is encouraging. And could you apply some version of that to other vaccine development? Absolutely. So although the focus right now, rightfully, is on COVID-19, some of what we've learned could apply to things that are more routine.
In terms of planning these vaccine trials, you mentioned the Oxford University vaccine that Michigan will be joining in on the trial on soon. You mentioned all the planning that goes into this to manufacture this trial in a way that's going to be effective in teaching the medical community about the behavior of these vaccines, the efficacy of these vaccines. What does go into that planning? What variables are teams looking over as they are preparing to begin any phase of these trials and make sure that these vaccines are going to be effective and be safe down the line as well?
Yeah, thank you, Tyler. And safety is, of course, very important. And there's sort of immediate effects, and then there's longer term effects. And that's part of why it takes a little while to determine those endpoints. But with the phase 3 trials that people have heard about, this is where you really want to see disease prevention. So some of the thought behind this is making sure that not just that you're vaccinating a large number of people, but you need to vaccinate people that have enough risk that they're going to come in contact with COVID. Because to see a difference between, in this case, the placebo is one of the placebos that's been used as a meningitis vaccine versus the candidate COVID vaccine. And then to see in the two groups, is there a lower rate? But you're not going to see a difference if you're in a place where there's not enough COVID. And so it's a little bit of a double-edged sword. We certainly don't want to see a lot of COVID in Michigan, but since the economy has sort of reopened and reengaged, we have seen like this kind of rising water of cases. So, for example, one of the things I think a lot about are college students, and they would probably be a good audience to vaccinate in a trial, of course, if they were interested and with all the usual safety measures, because their behavior puts them at higher risk than someone who maybe is staying home all the time. Healthcare workers, essential workers. But it is also important to make sure that we do these studies in large numbers of people who are older to see how it works in older adults, since they are some of the highest risk groups for poor outcomes.
There's been so much confusion surrounding COVID-19 and the steps that need to be taken. And, is the government going too far? Are they not going far enough? As someone who is an expert, what is your take on it? Are we doing enough, or should we be doing more?
Yeah, so there is a lot of confusion, and it's understandable. This is coming at us 24 hours a day, and it has been since January. People maybe started paying more attention late February, March, but we're sort of at the point of exhaustion with COVID-19. In terms of taking steps, the public health measures are important at the individual level, but really at the level of the population and the economy. And I'm most familiar with what's happened in Michigan, and I will say that I'm very proud of the steps that our state has taken and that Michiganders have taken to help support it. In particular, one thing we have learned, and this wasn't something we knew at the beginning, is that the benefit of masks is tremendous. And as we think about getting back to school, masks are going to be part of our uniform. They're going to just be part of what we do when we leave our home and we're not by ourselves. So I would say that the approach has really varied state to state. In some ways, the U.S. is sort of like 50 countries when it comes to COVID response. And some states have done better than others in terms of just shoring up all of the different public health resources and different rules. But I would say that Michigan has done a really good job, and that when you don't have clear advice on this, and in this case, masks is a good example, because it's hard to institute limits on everything. There are some limits on the number of people that can gather, of course, but this is something that you see a difference within the matter of days and weeks, and we are starting to see that here. Our numbers have they've stayed about the same, and they're not going a lot higher, but we still worry that if people can't keep to those general principles around watching our distance, wearing masks, washing our hands, that we could see an upsurge and be back to where we were in March.
Well, we definitely don't want that. Testing is another area of confusion. What tests should you get? Who should get the test? And how accurate are they?
So this is a great question. I'll try to give a very quick overview because this could take a long time otherwise. So in general, there are a couple different kinds of tests that people might hear about. One is a test for the virus or a test for infection. The other test is an antibody test, sometimes called a serology test, which looks for past infection. And there are a couple different buckets of people that we think about testing. One is those who have symptoms. So you have a cough, you have a fever, or you came into contact with someone who had a documented COVID-19 infection. Those are individuals that I put in a bucket of needing a test. And the types of tests might be a little different at each place. The turnaround time might be different. This has been something that has gotten a lot of attention. In the clinical setting, we really need rapid turnaround. And some places like Michigan Medicine do have rapid turnaround. If the test is done off-site or it's sent away, it might take a few days. Probably average is 2 days, maybe 3 days. We're certainly hearing about cases around the country where it's taken 7-8 days to get a result. And frankly, it's not that helpful at that time. So that time, turnaround time is essential. And that's something that states need to really work on for the safety of their state. The other bucket of people are those with no symptoms and whether they should be tested. And there are certain buckets of individuals, certain jobs where people are being tested. And this is the one that comes to mind is people working in nursing homes are being tested. And this is part of a newer approach that we didn't have a few months ago. But this is to protect people who are very, very vulnerable. A lot of schools and colleges are looking at how they're going to test people with minimal symptoms or no symptoms to sort of make sure that you're not having widespread infection and not be aware of it. And again, those kind of tests could be a little bit different. Ronnie, you asked about how good the tests are. One thing to keep in mind is that the way the test is done really matters. So the test that probably you've seen on TV where it's called a nasopharyngeal swab, and it requires a medical professional to do that because you have to really go pretty far back into the nasopharynx and through the nose. The other tests might just be collecting saliva, but making sure it's collected properly. Some of the newer approaches are something called an oral swab, where you take a swab and you go into the mouth and take saliva. This is really important that it's done correctly and the right amount of saliva is collected. So there are all kinds of things being done to try to improve the collection. And then some tests are not as sensitive. They're not going to be as likely to pick up a positive. And if you're doing screening of people without symptoms, that might be okay, especially if you're doing thousands of people. But where it's not okay is when you're thinking about someone who is ill with symptoms. You really need a highly accurate test in that setting. And the good news is as testing is becoming more available, it's becoming more convenient, but we're still not where we need to be. And so I'm looking forward to more progress in the coming weeks.
Dr. Preeti Malani with us. She is the Chief Health Officer and Professor of Medicine in the Infectious Diseases Division at the University of Michigan with us on the Oakland County Megacast. Dr. Malani, as we are approaching returning kids to school in a couple of weeks, there's been some requirements in the last couple of weeks for summer school classes, particularly the court-ordered ruling in the Detroit Public School District that all students that were going to continue with their summer school courses in order to do so had to be tested for COVID-19. In your opinion, as we're returning kids to school, is it worthwhile? Is it smart? Should it be done where we have kids be tested or teachers be tested consistently for COVID-19 to ensure that they are going to school healthy for in-person learning?
Yeah, so this is a difficult question. And I'm going to say it depends. It depends on the setting. There are some settings where social distancing can't happen. And if you can have some sort of test where the turnaround time is rapid, where it's convenient to do, where the cost is manageable, certainly testing would be helpful. but it's very difficult at this moment, and this could change in weeks and months from now, to really be able to do consistent testing. What I don't feel is necessarily very helpful is requiring everybody to go get tested 2 weeks before starting school. And I know that some schools are asking for that. I'm not sure what that's based on, but again, that risk it's not a one-time risk. It is different if you're moving into a boarding school, for example, where you're coming into a community and then you're not going to really leave that community. It's going to be a little bit more enclosed. And the example I'll point to is what's happening in professional sports, where there's testing all the time of people, and they're finding positives, and they're removing them, and they're finding that it has spread to other members of the team. And classrooms are kind of like a team. And depending on the kids and their ability to socially distance and wash their hands, it can be difficult. Testing could be part of the approach, but we need to be aware of what testing does and doesn't do. And just like for adults who are out and about, face coverings are important in the school setting. And again, it could be a little bit more difficult, especially in young kids, to be able to have them do that. But there are ways to encourage good mask use and to provide some breaks for the kids to be able to remove their masks safely also.
Dr. Malani, on the question of testing and the timing of testing, with the delays that we are seeing from many labs in the state of Michigan that have caused delays in some COVID-19 case results being reported by the state, I have a question of who should go get a test. If someone's curious, should they get a test, or should they wait until the systems at B are a little less backlogged? Or should anybody that is curious or definitely if they're feeling symptoms, go get a test? So the second part of your question is the easy one. If you have symptoms, absolutely you should go and get tested. And there are resources on the Michigan Department of Health and Human Services website, COVID-19 page, to help make sure that you can get somewhere to be tested. A lot of the health systems also have that information to be tested in a safe and convenient way. Even mild symptoms, I would say, if you've had an exposure, that's another reason to think about being tested. And again, it's a little bit case by case. At this point, I would not recommend that people that are asymptomatic on large scale be tested, unless they're going to be maybe going back to school or going back to college. And again, it really depends on the scenario. And your point is well taken. It is for some of these tests, these are also used in the clinical setting. And although we're kind of in an okay situation right now in Michigan, what one of my colleagues calls it is sort of the rising water. And the water's rising, but it's rising slowly. We do worry that we could get into a situation that we are not able to support the testing that's needed for the clinical setting, or if there's a big exposure in one, like a workplace or a nursing home or a school. You want to make sure that we have enough supplies. So just curious, not sure, probably could wait. Especially if you're practicing socially distance, you're practicing all the other things that need to go into our everyday lives. Dr. Malani, just another minute or two with you before we have to let you go. Any other important information that our audience should know at this point in time as we continue to battle COVID-19?
One of the big things is we're so focused on COVID-19, and it is the primary issue. But I say this as a parent. We do need to think about our kids' well-being and our own well-being. And what I've really asked people to do is try to reframe our social interactions right now to think about what we can do instead of what we can't do. I've shared this information with friends, family. Have a couple people over, meet outside, have that interaction. Do it in a way that's safe, that provides social distancing. We're not in a situation where we can have 100 people in our backyard safely, but think about what we can do. And I would say the same applies to kids, because being connected to each other is also really important. And the masks do offer quite a bit of safety. So, it's going to be part of our life for the time being, for as at least a foreseeable future, but really focus on what we can do instead of all the things we can't.
One last question for you. when you say, it's okay to be outside, there's less of the chance of a spread when you're outside. I really thought we'd see much more of an uptick with all of the protests going on because you are having large groups gather. Why is it not spreading through that group of people, do you think?
Yeah, this is a good question. And, part of it is that maybe not everyone who went to protest got tested. So there could be that people had mild infection. There were recommendations in some places to please go get tested. It may be that at least the peak protests in Michigan sort of happened at a time, this was early June, late May, that we weren't seeing as much, we weren't seeing as many cases, so that might have contributed. The other thing is a lot of people were wearing masks and trying to socially distance. There were all kinds of different protests. Like protests, what we see on TV isn't really what was happening in a lot of spaces where people were spread out. They were practicing good hand hygiene and all those things. So maybe that we weren't seeing transmission. And as you know, Ronnie, like it is harder to transmit outside. It's not impossible, and we're certainly seeing that. But it tends to be close contact, no masks for an extended period of time. Some of the protests around the country, the places that they saw spread was in the after parties, which occurred indoors. So again, no activity is fully safe. We can make it safer. And all of us share risk, and we all share responsibility.
Dr. Malani, thank you very much for being with us today. We appreciate it. Dr. Preeti Malani from the University of Michigan with us on the Oakland County Megacast. That is going to do it for our programming, our live program this week. You can watch us Monday through Friday, 10 a.m. to 12 noon, and in the evenings during the week and all throughout the weekend. For all of our guests this weekend on today's program, for our Facebook partners and our entire crew, I'm Tyler Kieft alongside Ronnie Dahl. Thanking you for tuning in. The Megacast returns with new episodes on Monday.